It is time now for Ask the Expert. It is World Hepatitis Day, a day to raise awareness of the huge burden of viral hepatitis and to influence real change.
It is a big issue. Joining us today from Aurora St. Luke's Medical Center is Dr. Ajay Sahajpal, a transplant surgeon whose team at Aurora St. Luke's has developed an innovative program to help people diagnose and then treat a deadly disease that oftentimes is undetected. So, doctor, thank you very much for being here. What is hepatitis and what should our viewers know about it?
So hepatitis is a virus. It's a blood-borne virus that affects the liver. It's the #1 cause of needing a liver transplant. It causes cirrhosis, liver cancer. So it's a pretty aggressive disease. Historically.
And Hep C, what causes, let's start with Hep C, what causes Hep C?
So hepatitis C typically is bloodborne, so that the most at-risk population really is baby boomers, so before we were screening blood. And then IV drug users, which, you know, with the opioid crisis and things now, it's actually starting to peak again as a risk factor.
So what have you done with this screening program at Aurora?
So as one of the missions of Aurora with helping people live well, population health was a big priority and is a big priority. So 3 years ago we developed a screening program using the electronic medical record, using CDC guidelines that call for screening the at-risk populations we discussed. And we just leverage that so then when patients come to the doctor for their annual physical, if they're a baby boomer, a flag pops up in their chart and we suggest screening and say you're at risk, because it really is a silent killer. People can have the disease and they don't present until it's too late and they need a transplant or they have a cancer or there's nothing that can be done.
But if you do know early on, it's something that's manageable.
Yeah, so we've screened about 55,000 patients.
Wow.
And 1,000 were identified. Most were walking around not knowing, and they can be cured, so they never run into any problems. A couple were found later on and actually ended up transplanting them for cancers.
So it is curable and it can also then be managed.
Exactly.
All right, so give me a sense, though, you say when people come in to see the doctor, there's concern for folks who maybe aren't seeing their doctor. How would you encourage people to come in? What is a way to sort of find and reach out to people who could be carrying this around? So
a couple different strategies. Segments like this are quite helpful, actually, so thank you for doing this. We have partnered with the community, so we do work at 16th Street Clinic, the AIDS Resource Center, the county. So we are trying to get the message out there and help people when they come in for any type of needle exchange or anything.
Right, and just talking about it and making people aware, then the patient can ask their doctor about it if they aren't in one of your clinics or through the Aurora program. Okay.
Thanks for helping us make a difference on this issue.
My pleasure, thank you.
All right, got a question for our experts. Email them at asktheexpert@today'stmj4.com. You can also leave a voicemail. We do have the number right there for you.